I'm pleased to welcome one of our lead sponsors, a good friend, the President and CEO of the Alliance for Aging Research. Please welcome Sue Peshin.
So a very special birthday is coming up this summer. On July 30th, Medicare and Medicaid both turn 60. That means Medicare will be only 5 years away from being able to apply for itself. And we're going to sing happy birthday. All of us are going to sing happy birthday. So look up from your laptops, whatever you're doing, join in. These programs are important. Happy birthday to you. Happy birthday to you. Happy birthday, Medicare and Medicaid. Happy birthday to you. Very good, all right. I think you guys have a side hustle if you need it. All right, so in the last 60 years, these programs have had an immeasurable impact. Today, Medicare covers more than 68 million Americans. 90% of them are older adults, and the other 10% are people with disabilities under the age of 65. The most significant growth in the program happened in the last 15 years, when enrollment ballooned by 20 million people. With more people, higher total costs come. That's why we often hear about the need to cut costs. But our hyper-focus on cutting costs overall might be clouding the original promise to be there for each person when they need it. Raise your hand if you've ever worried for you or your loved ones that you're going to hit access barriers in healthcare. And for those of you watching, it's most of the people in the room. And I'll tell you something, our fears are legit. In the last couple of decades, we've seen increases in utilization management abuse by Medicare payers and PBMs. They've been enabled by the Centers for Medicare and Medicaid Services' lack of guardrails. But this can be fixed, and this is what we work on a regular basis. This has also shown up in the narrowing of prescription drug formularies, more requirements for prior authorization and step therapy, and even attempts at differential pricing schemes. And this has shown up in Medicare coverage policies for treatments for heart valve disease, for cochlear implants, and for Alzheimer's disease. And all these types of policies challenge the FDA's biomedical expertise, and they ration care. And it's all under the guise of, we need to develop more evidence. And this has also shown up in over-regulation of clinical care in nursing homes. We need to be careful, because what's happening is not only impacting Medicare beneficiaries, the private market follows Medicare's lead, which affects another 180 million Americans in group health coverage. We were pleasantly struck by how Dr. Oz answered one of his questions at the Finance Committee nomination hearing, and it was about utilization management. He said, quote, "That is one of the most frequent complaints physicians hear from patients is I can't get the treatment. I really know what works for me, but no one will give it to me even though I have insurance. I'm a beneficiary. I should be allowed to get access to this medication, which I'm told is in the plan, and yet it gets slowed down." End quote. What would it look like if we gave everyone the care they needed when they needed it? That's what the Alliance for Aging Research focuses on, changing the narrative to achieve healthy aging and equitable access to care. Now, of the 68 million people in Medicare, 1 in 5 are also on Medicaid. So I just want to be clear here. Any proposed cuts to Medicaid are, in effect, cuts to Medicare. If the proposed $880 billion in Medicaid cuts are finalized, states are going to have little choice but to cut optional benefits that aren't covered at all by Medicare and aren't required to be covered by Medicaid. So, for example, Coverage of nursing home care for Alzheimer's is required under Medicaid, but home care isn't. Ironically, states may end up paying more per beneficiary for nursing home placements than they would for allowing people to live at home with home care support. And states with higher older populations, many of them rural, are going to be hit harder. We all need to step up and be thoughtful about how proposed policies are going to impact taxpayers. If we need to change these programs, let's do it, but don't take them apart. A lot of this is about how we value each other as human beings, no matter our age, ability, or our care need. After paying into the program our whole lives, we shouldn't have to worry or wonder whether we'll be able to get the treatments we discuss with our doctors and decide are right for us. 60 years ago, America made a contract with taxpayers to lift their worry and provide access to care as we age. If we get this right for older Americans, we'll get it right for everyone else as they age. And all of us are accountable to each other on this. After all, when all is said and done, all that counts is how we treated one another. And that's it. Thank you.